So, 10 reasons not to fear COVID. Number one, COVID simply isn't the unusually deadly killer that it's made out to be. And so context matters. In 2020, over 300,000 Canadians died in 2020. People dying of COVID or with COVID was about 15,000. So you've got COVID deaths at roughly 5% of total deaths, not a significant portion. The other thing that has not changed from previous years is that cancer, heart diseases, and respiratory diseases continue to make up more than half of the deaths in the country. So these three big killers are still the three big killers. Nothing's really changed from previous years in 2020. Second reason not to fear COVID is that it has only a negligible impact on life expectancy. We see this from Statistics Canada data that the death rates in 2020 in Canada were very consistent with death rates in 2019, 2018, 2017. We see it from the data provided by Alberta Health Services and other provincial data that the people dying of COVID, more than half of them are over 80, more than half of them are already older than the average life expectancy. This is a disease that is harmless for children and has very little impact on people under the age of 70. It doesn't take a lot of years off of your life. And that's relevant because the way to measure the impact of diseases is to ask how much do they shorten your life by, right? Because we're all going to die. Nobody's escaping death. So the big question is this a disease that is taking, days, weeks, months, years, decades off of people's lives? If there's a disease going around that's killing young adults in their 20s, or if we had a huge wave of suicides amongst people in their 20s, that is taking a lot of years off of people's lives, right? If a 20-year-old commits suicide, that's a loss of a lot of years of life.